And we are the Coalition, loud and proud right now. We're in the heart of Rhode Island State Government here at the Department of Administration building. We've just concluded a meeting, well, I guess what I'll call the COVID-19 Equity Council. Hopefully I've got that right. It's an accumulation of community leaders, many of whom from the BIPOC community, as well as governmental officials who are addressing what is clearly inequity in the delivery of goods and services in the form of anything from vaccines to the federally mandated rental relief to members of communities that are in pain and quite frankly, severely disadvantaged. I'm standing here with Dr. Pablo Rodriguez. Of course, he's been associated with everything at a certain point, but he's always been a prominent voice for justice amongst the Hispanic community, both in medicine and communications. And I want to ask him a question. First of all, Dr. Rodriguez, thank you for joining us.
It's a pleasure to be here.
I voiced my frustration at the end in sort of a kind of an informal media / public comment. The rental crisis has been going on for a year and a half now. And at the risk of bloviating again, you've got two groups of people suffering, many of whom are from the minority community. You've got landlords who haven't been paid in an enormous amount of time, destroying their credit. Interestingly enough, and as you know and as I know, and some of our listeners may not know, a significant number of landlords in sub-5 unit multifamily dwellings in this state are in fact members of the minority community who are using or were using real estate as a step up, if you will, on the American economic ladder. Many of them first and second generation Americans. So people are literally getting crucified this. What's it going to take to light a fire under somebody's?
Yeah, it definitely is a problem that not just began with the pandemic. This is a problem that has been going on for a long time here in Rhode Island. The cost of living has become absolutely, unaffordable for poor families and middle-income families. So the pandemic just basically exacerbated this by the lack of payment to landlords and the lack of money for rent for the people that live in those houses. So we have to do something different. We cannot continue to do the same old processes of hiring organizations that are not in touch with the community to be able to get this information to people and be able to fill out all these forms that are necessary for people to access the money. It's the same thing that happened with the vaccine in terms of the appointments. The system was just so complicated that it made it very, very difficult for people to access it. So I know that people want to access, I know that people have the need, but they are having barriers to entry.
You're talking about communities that, and I say this with a rueful smile, they were sort of on the verge of a financial nervous breakdown to begin with. Clearly, the pandemic pushed them over that. I won't put you on the spot, but there are prominent organizations in this state who've made a lot of money over the years. We all know who they are, that we don't need to name them again. But a lot of people have gotten rich, and I'm using the coalition air quotes, helping the poor. Aren't there significant community-based minority-run organizations that have demonstrated financial responsibility, in some cases for generations, that should be capable of taking this and quite frankly, sharing in some of the federal largesse that's being handed to the usual suspects?
They are, and the problem here is the constant bureaucracy that is required of people that are, of organizations that are doing the work. And that bureaucracy basically disqualifies, community-based organizations and people that could be doing this job much more efficiently and for much less cost, by the way, than what we are doing today.
Again, thanks for your involvement. It's good to see you again. You and I have run into each other in a few places. One of them being we paneled together a number of times on a lively experiment, and you and I always had a great deal of fun, occasionally at other people's expense. Dr. Pablo Rodriguez, community activist par excellence. Thanks again for joining us.
Thank you. Thank you a lot, Pat.